So in the second section of our lecture, now we will talk some other disorders that affects the infant age group. In this, we will talk about the labial adhesions, muco or hydrocolpos, and then we will talk about ovarian enlargement and ectopic anus. So first, the labial adhesions. Condition when the labia minora have adhered together. So in this picture you can see it's a labial adhesion in a 1.5-year-old girl. So these are the labia minora is adhered, and it's the 1.5-year-old girl with the labial adhesions. So this is the picture. There is also associated with labial adhesions, we see adhesive vulvitis, and usually there is, as a result of adhesions, infections are common, so we can also see adhesive vulvitis due to mild infection of the vulva. Lack of local defense due to absence of estrogen, and it starts from behind forward, leaving a small opening at the foremost tip. So usually it starts from behind to forward. So at the top usually there is a small opening at present. So labial adhesion is the labia minora are adhered together and start from behind forward. So usually you see a small opening at the foremost tip. Infections are common, and as a result we see there is usually adhesive vulvitis. Adhesive vulvitis because there is more chances, or is more prone to infection because of decreased defense mechanism due to absence of the estrogen. The diagnosis and treatment, here also you can see is the picture where we have the labial adhesions. So diagnosis and treatment is usually, it may cause difficulty in micturition or periodic attacks of urinary tract infection. If there is difficulty in micturition or urination, usually it leads to urinary tract infection because of obstruction to the flow of urine, or there is urinary stasis. Whenever urinary stasis is present, there is more chance it can lead to urinary tract infection because the labia minora is adhered. So because of that adherence, it can cause obstruction to the urinary outflow. There is also inflammation of vestibule and vagina. Confusion usually is with imperforate hymen, agenesis of vagina, and intersex. So it can be confused with imperforate hymen because of the fusion. It can be like imperforate hymen, or it may be confused that maybe vagina is not properly developed, or there is agenesis of the vagina, or it can be confused with the intersex. Treatment of labial adhesion is separation of the adhesion using probe or finger. So adhesions should be separated. Or if the raw area is treated with topical application of estrogen or any antibiotic that prevent re-agglutination. So first, removal of adhesions using finger or probe. Once the adhesions are removed. Usually it leaves a raw area that is very, very sensitive, or it can bleed easily. To treat that raw area, usually the treatment is done by estrogen that can improve the or it can increase the healing, or it can remove treat that thinning of the skin that is present, or the raw area that is present. And some antibiotics can also be used that can prevent the reagglutination. Next was muco or hydrocolpos. It's muco or hydrocolpos is the presence of mucus or fluid in the cervix or in the vagina, usually as a result in cases when there is imperforate hymen or a vaginal septum. There is collection of mucus or the fluid that can cause formation of the muco or hydrocolpos. Increased secretion of water or watery discharge from the cervical and uterine glands. Large quantity of fluid is collected in vagina, which produce hydro or mucocolpus. So what happened if there is imperforate hymen? Hymen is, as we talked it before, that it's the lining on present at the outlet or opening of the vagina. When it is imperforate or it is not perforated, usually there is a collection of mucus or any other secretions. Even when the female or girl start menstruating and she has imperforate hymen, there is collection of blood also in the vagina also. As a result, it causes pressure on the hymen that sometimes get perforated, or it can cause a mass leading to hemocolpus also. So this is all as a result of imperforate hymen, or if the septum, or if the septum is present, or it can cause the collection of the fluid or mucus behind in the vagina or the cervix as a result of production of mucus from the cervical and uterine glands. When this is present, usually incision is given to drain the mucus or the blood. Hematocolpus also is presence of blood in the cervix and the vagina that also sometimes reach to the uterus, causing hematometria, and this forms a mass that can be palpable in the lower abdomen. So muco or hydrocolpus or hematocolpus is due to imperforate hymen or the septum present in the vagina. This can cause collection of the mucus or the fluid or the blood into the vagina or the cervix that leads to formation of mucocolpus or hematocolpus. The treatment is a cruciate incision into the hymen or into the area to drain the fluid or the blood. You can see this is the hemato. It's enlargement of the uterus that can be drained by the cruciate incision. Usually urinary problems are present associated with muco or hydrocolpus. These urinary problems are because of the pressure on the bladder caused by the collection of the blood or the mucus, and usually these urinary problems can lead to urinary tract infections. There is dysuria, there is urinary frequency, urgency, and also there is lower abdominal pain. lower abdominal lump is also present with hydrocolpos or mucocolpus. Bulge of the obstructing membrane, which looks shiny as a result of the pressure on the hymen. The hymen bulges out, and this is the membrane looks shiny. Next, ovarian enlargement and ectopic anus. Ovarian enlargement is usually due to the transient elevation of gonadotropins in neonates. When gonadotropic hormones are increased in the neonate, this leads to ovarian enlargement because gonadotropic hormones like follicle stimulating hormone, luteinizing hormones, which are produced as a result of gonadotropin releasing hormone from the hypothalamus that act on the anterior pituitary, and anterior pituitary gland in turn produce follicle stimulating hormone and luteinizing hormone, and these hormones have effect on the ovaries and causes maturation of ovarian follicles, and this can lead to ovarian enlargement in the neonates. This cause produce ovarian follicular cyst and causes. This can regress spontaneously on its own once the production of gonadotropic hormones, after it comes back to normal, it regresses spontaneously. Then we have another condition known as ectopic anus. The anus is not on the opening of the anus is not in the normal site, and the anal canal may open either in the vestibule or in the vagina. So anal canal is open in the vagina and the vestibule, and all the anal secretions is like a fistula that comes through the vaginal opening. In this diagram, you can see fistula, fissures. Fissures are the lacerations and the cracks in the anus. Very, very painful condition. Sometimes there is formation of abscess in the anus also, and this is anal fistula when the opening is or there is a connection between the two organs, like between the anus and the vagina, and there is fecal discharge coming out of the vagina. So ectopic anus, the anal canal may open in the vagina or in the vestibule. So that was all about some other disorders in which we talk about the enlargement of the ovary, ectopic anus, and some other disorders that affects the infant. So thank you for watching sqadia.com.